Welcome to Facts in the Future of Healthcare. This Podlet series with Isaac, Charles, that would be me, Zach, and Brenton. On this episode, we're going to have a short discussion about why healthcare is important, and then later move on to some of the logistics and specifics of what a universal healthcare might look like, whether it'd be good for us, whether it'd be bad for us, and how that would work. Now, welcome. Starting the discussion off will be Isaac Wayne.
Healthcare may seem like a very common commodity, and in the modern world, it may not. It may seem very accessible. However, millions of Americans around the country don't have access to healthcare. Mr. Cunningham, could you give us a few facts about Americans and healthcare and how it impacts their daily lives?
Yes, Isaac. So about 130,000 Americans died between 2005 and 2010 because of their lack of health insurance. And also on top of that, 25,000 to 45,000 Americans die annually due to lack of a healthcare provider.
So Brendan, that's a lot of people dying annually without healthcare. Is there a correlation between the death rates of people with healthcare versus without?
Well, yes, Isaac. People ages 25 to 64 were 25% more likely to die if they lacked health insurance.
Wow, that's tragic, and that's such a high death rate. But just to put it into perspective, do you know how many Americans don't have healthcare?
Well, as of 2018, 27.5 million Americans do not have health insurance.
Wow, that is a massive portion of the country. And I mean, just listening to you, this is crazy, these statistics you're citing. Wow.
So that's a lot of people in the US. Do you know how that compares to other countries? Does the US's healthcare system match up against other countries?
Well, Isaac, the quality to cost ratio of the US healthcare ranks 41 in the world, which is really low number considering our status in the world's economy.
We are one of the largest countries in the world and definitely one of the most powerful, yet most people pay around $1,000 for healthcare a month, something that most people would consider to be an essential service.
That is absolutely, that's just insane. We need to do better here. It's so clear from these statistics that we as a country, we as a group of Americans, if we want to continue to say that we are proud to be Americans, we need to stop our people from dying because of this.
Well then, why don't we have it? What are some of the challenges in implementing nationalized healthcare? It's been tried before and it's also been shot down many, many times.
Well, a lot of the big challenges here are kind of ingrained in the American culture and some special interests, and we can get to that in a later episode. However, one thing I really want to highlight here is moving on to some of the logistics of how this would work, is that if we had universal healthcare similar to the NHS or many, many other European systems, this wouldn't mean that there was extensive waiting for everything. I mean, there might be some waiting, but I mean, think about when you go to the ER, think about how long you have to wait then. Saying that there would be extensive waiting with universal healthcare, there's extensive waiting now, and it might even be quicker because there's less bureaucracy. And even, this wouldn't even mean that you have to go, if you have to go to public healthcare. If you have the money and you have a doctor you really like seeing, you couldn't pay extra and stay private. I just don't get why people would want more people to die.
That sounds all great, but how do we fund this this major action? How would the government fund this?
Zach, do you want to take that one?
Well, it's not that the government does not have enough funds to pay for a nationalized healthcare service for all, like free healthcare for all.
I know that we have debt, but there's a lot of things we can do to rearrange the way we spend money. And in fact, something like having nationalized healthcare would be cheaper than the current system. Like it'd be significantly cheaper because right now there are a bunch of different companies, so you have to pay for all that bureaucracy and all of those taxes and fees
Instead of just paying
company.
it all straight up on your taxes, and then
Yeah, exactly. So your overall, how much you're paying would go down significantly. I mean, how much you pay in taxes might go up, but that it doesn't mean that you'd pay more or you'd end up with less money in the end. In fact, this would make you money. Isn't that insane? It would help people and make you money.
Yeah, studies show that your annual FICA tax would only go up 0.3%. So I know that 7% of the current budget is allocated towards stuff like Medicare, Medicaid, and just overall health and human services. Would we have to take away from certain sectors of the government, or are there government sectors that are overspending that we could possibly use to put towards healthcare?
So to answer that, so the military currently has 57% of our budget, which, I mean, our military does do some good work, and so we might not even need to cut that, because, like I said, even increasing taxes just a little bit you would only need to increase them a little bit, and that would and you would get rid of all your expensive healthcare bills that you already pay. So if we wanted to, we could cut places like the military, but we don't even need to, and that's not really even necessary for a bill like this to pass. Even though our military does have currently a little more funding than it needs, but we don't even need to cut that to pay for this. It would just be so much cheaper all around.
So overall, it seems like this episode we've covered how it financially makes a lot more sense to have a publicized option. So next week, we will cover why we haven't had healthcare in the past and what goes into an effective healthcare bill. We'll see you next time.
Thank you so much for listening.
See you next time.